everyone, and welcome to a little bit of information about how to increase your profitability and outcomes with technology for dry eye disease. I am so excited that you've had a chance to listen to so many amazing people teach you more about dry eye disease. And I don't know that I'm the one that's going to do that, but what I will do and what I love to do is I love to talk about money. I love to talk about outcomes. And because this is not a CE program, I can do that. So what we're going to do today, and this is a disclosure slide, which technically I don't have to have here, but I do have it because I want you to know a little bit about where you can find me, what I'm doing these days. You can find me in the magazine, Optometric Management Magazine, or on the podcast that David and I do. But I want to also give you a little bit of my background. So I graduated from optometry school in 1995, which is important because at the time, dry eye disease wasn't even considered a disease. I went to do my residency in Boston at the Brockton West Roxbury VA Hospital, and my residency's in contact lenses and ocular disease. Then I leased space in three Walmart Vision Centers for 6 years. And then I bought my practice in 2002 here in West Palm Beach, Florida. We have 2 doctors in the practice, and our practice is really general optometry. What I found out when I bought my practice is that there isn't really a playbook for how to implement technology. There really isn't a playbook for how you combine technology with disease process, how you're profitable, and then also how you improve outcomes, because ultimately it's important to be able to pay the bills. But the thing that we all want more than anything is to bring value to our patients and to make sure that they're healthier. So I'm so glad you're here with me. I know I've got several friends that said they were going to be here today. Probably all of you are my friends, and we all know each other very well. But this is all about an amazing moment for Reichert and for optometry. Now, if you remember the history of Reichert, which I think is incredible, they actually are the inventor of the phoropter, and they just celebrated in 2022 their 100th year of the phoropter. Think about where our lives would be had we never had a phoropter to completely change optometry. Then the lensometer, the non-contact tonometer, a lot of you may not know that was in 1972 that was invented. And the good thing about that is we needed it more then than ever because we couldn't even put anesthetic drops in our patients' eyes. So Reichert has always been a leader in innovation and helping us to bring technologies to our practice that help us to really make our practice better and bring value to our patients. You've heard me talk about the ocular response analyzer and corneal hysteresis, which they also brought to us. So thank you to Reichert for this session today for all of you, and thank you for having me here. But what we're going to talk about today, and you're the first to hear it, so this is a big moment for you, for me, for Reichert. We're going to hear about their dry eye platform. Dry eye and ocular surface disease is a big deal, and Reichert knows that, and they know that one of the pain points, and we're going to talk about that in a moment too, is really how do we make it simple for us in our practice, which makes it better for our patients. But why is this even a topic of conversation? And I know you've had a lot of CE, so I'm not here to teach you about dry eye. I really just want to show you how you can make it simple and make it work for you in your practice, whether you're an associate, the owner of your practice, in a commercial practice, a private practice, MD/OD practice, this is for you. So if you are getting your cup of coffee, eating your lunch, I hope you'll pay attention and look at what Reichert's brought to us. That's quite amazing. Now, I had a dry eye talk twice already this past week, and probably I think total number of people that were listening overall were more than 500 people that participated. I polled them and I said, what is the prevalence of of dry eye in your practice? And believe it or not, I give you this crazy 20 to 70% number, but believe it or not, the average number I got from everybody that was responding to our poll, 60%. And that's why this conversation is so important, because there isn't really anything that's more prevalent in our practice other than myopia. And so as we look at the numbers in the world in dry eye disease, I think the thing that stands out to me is that only 1.5 million of those 30 million or greater patients that have dry eye disease have been treated with a prescription. And so as I talk to my patients, I tell them, it's a multifactorial disease. So I tell them there's many reasons it happens. There's many things that are a part of it, but it really results in inflammation and can result in damage to your eye. I walk them through this, and we sometimes have diagrams we use. I think the hardest part about all of this is how do we educate our patients and how do we help them to understand the seriousness of this? I told you in 1995 was when I graduated from optometry school. It wasn't even a disease at the time. It was considered a disorder of the tear film. It wasn't until 2007 that dry eye disease became a title, a name. And the reason that's important is because you can now bill for visits with that as a diagnosis. And then in 2017, thank you to TFOS, we now have a better designation, and they've given us so much information that we can use. I know you've had a lot of education about this report in the last couple of days, and you'll have more. So I'm not going to dive into it deeply. All I really want you to remember, and I remember, is that one of the most frequent causes of patient visits to our practice really revolve around dry eye disease. And in the old days, what we were taught, I know maybe not all of you are as old as I am, but in my day, what I was taught is that it was a disease of women over 40. And now we know that is just not true because of the fact that people are on digital devices, because 3 of the top medications people take in the world today, antidepressants, anti-allergy medicines, and antihypertensives, those 3 medications, what's crazy is all of them have a negative effect on our eyes as far as dry eye disease is concerned. Then we look at lifestyle. In Florida, we have ceiling fans and air conditioning. In the cold states, you have heat. And so that's your environment that doesn't contribute to helping. And contact lenses. I don't know about you, but over 50% of my patients wear contact lenses. So that means that they're at high risk as well. Digital devices, we've told our patients in the past, incomplete blinking is a problem, but we've never had a way to show them what that looks like. So to be able to have technology that helps us to explain all of this that on a slide looks so confusing and so complicated is really quite incredible. So let's look at what some of those roadblocks are. What are our pain points? When you've been listening for the last couple of days, and again, more to come, and you hear all the excitement about dry eye, especially since it's so prevalent in our practices, what stops us from doing more? And really, why do we need new technology? Why did Reichert go out there and say, we need to bring something to the table for doctors because this is a problem? Well, I'll give you the answers that I was given in the last 2 times I lectured over the last week. And those answers were, the top on the list was, and I'm looking at my notes to make sure, time. It takes so much time, is what doctors said, to do everything you're telling us to do, April. So that was the number 1 roadblock. The number 2 was that patients don't listen. So now I have those 2 things. We're going to touch on those as we keep going. And I want you to go back to TFOS and look at the chart that you've been seeing and shown throughout the last couple of days. This is so important because you can do this all without technology. I agree. You have a slit lamp, you have fluorescein, you don't need technology at all. I think the challenge is, and it has been for me, time. And so everybody said time was their number 1 roadblock. I'm here to show you that you have a way around that. And I will tell you right now, before we even get that far, 2 minutes or less. Now, 2 minutes is a lot of time because really the capture of the data is only 15 seconds, most of the data. The reason I say 2 minutes or less is because when we implemented this technology, and the technology we have is the one you see right here, the OS1000, we trained our teams, by the way. We just had a new person in last week. We had to retrain. We trained our team in less than 15 minutes. And now they can go through all of the tools, the diagnostics that you'll see right here. And it takes less than 2 minutes per patient. Now that, I think, is something, if you're like me, really stands out. And I was really bent on finding a way. I was committed to finding a way for my practice to make this process easier. Now, when you look at the chart, look at what TFOS says is the path that we need to take. And by the way, that path is really important because that's what gets you paid for visits through insurance as well. Medicare lays that out very, very succinctly. But when you take this path, risk factors and triaging questions, for triaging questions, you can use a form, but you can also use this technology. It has in it all the questions you would ask somebody on the OSDI or one of the questionnaires that you want to use. So if you don't want a patient to fill it out, your team can ask those questions right there and populate it into the system. I like having a risk factor chart actually printed and laminated so I can show a patient. The reason I think this is important is because sometimes when they come back and they're not better, they could think it's my fault. And I want them to know, probably not, although there are stages in treatment which they need to understand, and we'll show them in the reports generated by this technology. But I also want them to know there's a lot of factors. And I want you, patient, to be aware that any of these factors that change can influence our outcomes with your treatment. So I would laminate this, have it handy so that you can use it as a talking point with patients. All right, here we go. This is the big moment. Let's look at the product overview for the products that Reichert has brought to us. And I know you're going to be super excited just like I am, and I don't want to make it confusing. I want to make it simple. So what you're seeing here are 4 different products. Idra on the right, OS1000 on the left, the anterior segment model so that you can hook this up to your slit lamp. That is the next picture down on the right. And then on the left is a treatment device, which is called Activa. Now, why do they have 3 different options? Well, because there are 3 different price points. And for some of us, there's no room in the office for a bigger piece of technology that's a standalone, which is what the OS1000 or the Idra would be. Some of you just want to have the pieces that you can then put on your slit lamp to create an amazing product that does all the same things, except for my OS1000 does topography. Now, I'm going to walk you through each of them, but I think what's really incredible when you look at this is, okay, what do I do? Which one do I want? How do I decide? Well, remember, you can jump into the exhibit hall that they have here, and you can talk to somebody from Reichert. But I'm going to walk you through how I made my decision, and then you can think about what makes sense to you. So Idra is this one. This is the one that the only thing it's missing in my mind is topography. And some of you don't need a topographer and you don't want that to be part of this. You might want this to be a standalone option that sits in your dry eye room or in your technology center that you don't care to have that piece. So what does it do? A lot, which is absolutely incredible. If you look at the second bullet point on here, though, performs tests essential to assess dry eye, according to the TFOS DEWSII report. Lipid layer thickness, non-invasive tear breakup time, meaning your staff doesn't have to put fluorescein in if they don't want to, tear meniscus height, eye blink evaluation, and mybography. Now, all of that can be done in 15 seconds minus the mybography. The mybography is really just another 5 seconds. It's just a matter of moving the lid, which you can have the patient do, and that's what we do most of the time, or your techs can. Your team can learn how to do this, I kid you not, in 15 minutes. And what's really cool, and it doesn't say it until down lower in the description, is there is a wizard that actually walks your team through what to do and what to say to the patient every single step. So it's pretty incredible to see how it works. One of my favorite pieces, though, you can see in the bottom right-hand side of the slide, the report that it generates for your patients actually tells them what the test result is, why it's important, and then we tell them that we're going to repeat this every single time they come in. So here's what you see, and your staff, your team doesn't have to do anything but push the button. All of this is done minus the mybography. Somebody's going to have to lift and lower the lids. All of this is done through the technology, and basically you're completing, according to what TFOS has said, you need these diagnostic tests, and you can then use them to show your patients, because remember the second thing that you guys told me, not today, but in the past, was your roadblock, was that patients don't listen. This is how you change that forever. Additional dry eye tests, you can see here below. We need to know if a patient has Demodex. You can see that. Now, the PDF reports that you get, you can look at them that way, or you can look at live reports, which are going to show you video. It's absolutely incredible to be able to show your patient these results. Now, the second piece of technology, again, does all of the dry eye stuff, but it also has built in a topographer. So if you're sitting there saying, okay, April said the 2 most prevalent problems we see right now in our practice are dry eye and myopia, here's your fix or your tool that's going to allow you to be able to help with both of those. So 1 device, 2 functions, small footprint. You can increase your revenue. Oops, I told you we talk about money. Okay, let's talk about money. How much can you charge for these things? That's up to you, but I would tell you, call around, see what other people are charging in your area. And that's how you can basically establish fees. Now, I'm not saying fees for doing the procedure. You can bill for procedures that are non-covered procedures. Some people do that, but some people do this as a screening to be able to help them determine who needs to come back for further evaluation. And then what you can do is you bill medical for those evaluations as they come back. All right, so here's the results of the exam of the OS1000. Wow, you can do all of this in less than 2 minutes. Doesn't that blow your mind? It's incredible what you can collect, the data you can collect with the technology. It's easy, it's painless, and the reports that you generate for your patients are phenomenal. Now, what I also love is that if you don't want to have extra technology that you have to have on a table in a separate location, you have the ability to put all this on your slit lamp. So that's really awesome to be able to say, okay, I don't want that. I don't have space, honestly, April. So what can I do? You can do all of this, again, minus the topography. You have a video camera. You have all the dry eye tests I just showed you. And it's incredible how fast and easy you can have a tech still do it, or you can. And this one I know you'll love. There is an app. And so all of the results that you obtain, if you want to, and you don't have to use this, you can activate the app for your patients and you can send them the results, the full assessment report of this, all the measures you took every single visit if you'd like. So I think this is really powerful as well because it allows you to securely share exam results, treatment protocols. And by the way, those treatment protocols, some of them are built into the system, so you could take advantage of them. But as you're learning in all of the education you're getting today, yesterday, tomorrow, a lot of the treatment protocols are going to be something you want to customize, and that's fine. You customize it, you set it up in the system. It's a one-time deal. Yes, it'll take you a few minutes, but then every report you generate is going to have that path laid out for your patient. So you don't have to be the one to spend the number one problem you said, spend all that time. And patients have access, they'll be more compliant. You will then see better outcomes. And that's the result of technology. So now we go back to this. We went through diagnostic testing. We did our triaging questions. We talked to the patient about the risk factors if we need to. That'll be a quick conversation. Now we're on to treatment. And so as you look at the financial impact of dry eye disease on your practice, look at what we've learned from, again, back to TFOS, the DEWSII report. You can find this all on the ocularsurface.com. What is step one of treatment? All things that you should have in the office. It is talking to them about modification of their local environment. And you can put all of that in your printout if you want to, that is generated from this technology. You want to tell them about dietary changes. And this is where you sell your first products. You're going to recommend a year's supply of omega-3s. Then you want to talk to them also about ocular lubricants. You sell your artificial tears, and keep reading your lid hygiene products and warm compresses. So April's way of doing this is that I screen every patient at their initial visit, and then I start them on step one right away. I educate them, give them a copy of their report, and I tell them this is what we need to be doing. We need to start you on this today. Now, I'll let you write down right now what revenue that would generate for you if you sold a year's supply of lid hygiene products, of hot compress to them, the artificial tears that you recommend. And I'm sure you've talked about FDA recalls in the last couple of days. So important that they get their products from us. And this is where the financial impact starts. Now, don't forget, if these patients have Demodex, then you have a treatment for that now. And you also have the option, if you don't have success with step one, now you move on to punctal occlusion, overnight treatments, and in-office heating and expression of the meibomian glands. And you move into what you've already heard about today, pulse light therapy, other therapies as well. So if all you want to do, though, is start with selling those products and doing heat treatments in office, that's a great place to start. You can do heat treatments that require you to do meibomian gland expression, and that's absolutely fine. Some people like to do that on their own in a controlled way. But what I would tell you right now is I think it's important to have more than one technology for heat treatments. I don't think there's one that does it for everybody. I don't think there's one that everybody is comfortable with. So I think having options like Activa that you can use in your practice for evaporative dry eye and MGD is really amazing. How often? Well, you can see kind of a path laid out here. This is what some people do in our practice. What we have found to be the most beneficial is week 1, week 4, and then we have them back every 60 days, like you see here. And the other thing you want to do is that's a great time to, again, run all those tests. It only takes 2 minutes. Show them their benefit, show them the results, show them how they're doing better, and talk to them about why we need to continue down this path. So Activa, what's really cool about it is not only does it do heating, but it does massaging. So you don't have to do meibomian gland expression afterwards if you don't want to. And so this is another option. Again, I showed you 4 products when we got started, 3 options for diagnosis, and then 1 option for treatment. So we're going to wind down, and then I want to make sure we can take some questions. But before we end, I want to encourage you, develop your protocol. You'll see protocols that are already in the system ready to go, and those are great. But you might have a different protocol based on the products you have, based on the heat treatments that you're going to provide, as well as what other treatments you're going to provide in your practice. So you don't have to do that. You don't have to enter any of that into the technology that Reichert provides. But if you do, it'll make it work even more to your benefit. And then use the wizard to train your team. I can tell you the one thing that we all are struggling with is getting good people on our staff to be part of our team and then training them. So this gives you a great way to be able to train your team and be able to help them to be able to do most of what you need done in the practice. The other thing you want is to make sure you use the reports that are generated from the system. You want those reports because they show them the results, and then they show them what normal should be, and they tell them what the treatment protocol is going to be moving forward. Again, you can customize it, so you show them as little or as much as you want to. And then at least at that first visit, I believe in starting treatment. I want to start the home treatments. I want to start them on omegas, and then I want to see them back. And typically what will happen there is I'll have them back in 2 weeks. If I need to put them on a steroid, I'll put them on a steroid. I have them back in 2 weeks. We run the tests again, and then we look to see what's going to happen next. You want to have all those treatments available in your practice, because if you have them available, then you can sell them yourself. And then when you bring them back with a medical diagnosis. Now, they may have come in with a medical diagnosis, and at some point, some of your practices, you're just dry eye. So they're all coming in that way. And if you're not on any medical insurance plans, that's fine too. All of it's cash pay for you. So as you look at going forward, how you want to set this up in your practice, I hope you'll send some questions in so we can answer them today. But if one thing that you think about here, I can tell you, majority of doctors, we just did the polling, say time and patient compliance are the biggest issues. Technology will help you to be able to answer those challenges. So let's get started. I promise you it'll make a difference for you. You have multiple options. I'll leave this slide up as we continue to talk so that you know where to go for more information. And then also remember that Reichert has a virtual booth, so you can go talk to some of their experts even today.
Thank you, Dr. Jasper. A lot of new information there, and I jotted down some things myself that I'd like to investigate. But we do have a question about, you looked at the 3 different diagnostic technologies that are available now through these platforms. Which was the one that you have? What was the exact name of the instrument? And then again, why did you choose to incorporate that out of the 3?
Well, fortunately, the slide that's up is the one that I have, so it helps me to explain. But I have the OS1000, the bigger device that you see on the slide in front of you. That one has a topographer in it. And the reason I thought that was important, even though I have topography, I wanted to be able to have another standalone device that would help me to be able to move patients more efficiently in the practice. And I actually use that as well for myopia management patients. So you know how it is in a general practice. It gets really busy seeing your comprehensive exams, your glaucoma patients, everything else. And so the challenge, I think, in a dry eye, in a general practice is how do you create that dry eye clinic? How do you take care of those patients the best without sacrificing in any other place in your practice?
And I think that you made a compelling case for the need for efficiency and to make it as simple as possible and have a protocol in a busy practice where you're doing lots of things that everybody gets screened, everybody gets education. You're making recommendations right then and there, and then you're bringing them back. What's going to be really interesting with the protocol that you are now bringing into your practice is historically, because you said it, patients don't always listen.
Yeah.
And we do our best to educate patients, even patients that are highly symptomatic. How do you see this looking now in terms of that capture rate where they come in for their comprehensive exam, you identify some symptoms, now you do a series of diagnostic tests in less than 2 minutes that you can show the patient, you can track over time. How is that going to change your capture rate?
I expect it to make a huge difference in the time that we've already been utilizing it. I can tell you that it has made it also has compelled me, Damon, to be more consistent. So I think that one of the other challenges, and I'll be the first to admit it, is that I'm the one sometimes that can get really busy and say, we'll talk about that next time. This doesn't let me do that. This keeps me consistent with every patient and helps them to see the value of their next visit. It also helps them to see the importance of them being compliant, not only with their visits with me, but with our recommendations, our prescribing that we do for them.
So my practice, I think is consistent with your polling of optometric audiences over the past week. I would say about 60% of our patients across the practice has some level of ocular surface disease that we need to intervene on. That 60% is such a huge number. And I think you laid out the cases. If we're not screening everybody for the most common reason they're coming in, the most common pathology they have is like, what are we even doing, right? We screen ad nauseum for glaucoma and AMD. I think you got to have a protocol though. And I think this allows you to do that. Would you want to elaborate on that in terms of the need for a protocol?
I do. It's interesting because I was on a call the other night and I heard Dr. Karpecki say something and it really it struck me. It was something that I never really thought about before. And that is that we worry so much about glaucoma. And don't get me wrong, I don't want you to stop. But it's the incidence, the prevalence is what, 2 to 3%, not 23, but 2 to 3. Now we have a condition like this, which could be blinding as well in some patients. I mean, at least the symptoms are worse than anything. Glaucoma has no symptoms at all. But here we have dry eye disease. And it's one of those things where I've even had technology in the past, Damon, that I wanted to use and implement to help me. The problem was it took so much time and it also required so much training for my staff. So the things they didn't like about it, they love here. The things that were time consuming there, we've solved that problem here. And having that protocol where every patient is screened and then this is what we do first, this is what we do on the second visit. And it can be a protocol based on visits, but also a protocol based on findings. And like I said, it seems really complicated, Damon. I think you are one of the best, if not the best, at laying that out, making it more simple. And you've always made a point or a case for the fact that you can do it without technology. But you've also helped us to be very clear, all of us, on the fact that technology makes it faster, makes you as the doctor, I think, more consistent with what you're doing in your prescription habits. And it helps the patients to really understand that what you're doing is making a difference and they need to be part of the equation, part of the solution.
I appreciate that, April. And I think that the points there is you got to commit to it. I mean, this is going to require change in your practice if you really want to do this well. You have to have a protocol that's written that everybody understands what are we doing here. And that continues to evolve in my practice based on practice needs, based on technology, based on what we have to offer patients. All of that's ever changing. But now you have a device that you can get a number test in 15 seconds. You can do myography and other things in less than 2 minutes. Pairing that potentially with the technology, although you made the point you don't necessarily have to pair that. You can use existing technology that you have in your practice as well. I think it's a call to action that we should all be thinking about doing things the way you're doing them. Is we've got a problem, we've got a huge number of patients that continues to increase in size. How do we solve that problem with technology? Final thoughts on bringing in any of these technologies on the diagnostic or treatment side from Reichert?
Absolutely. Reichert will help you to determine which one is right for you. But I will tell you, no matter what your mode of practice, this is something you can implement today and you can make a difference for your patients. Remember, the prevalence is higher than just about anything out there other than myopia. So this is an area for a way for you to increase profitability as well as improve outcomes.
Dr. Jasper, you are one of the very best out there doing so many things to help optometry, to help our patients, to grow practices. A lot of great tools here that we have now that are brand new through Reichert. I appreciate your time at Eyes on Dry Eye 2024. I do have a raffle code. The raffle code is TECH, T-E-C-H. Dr. Jasper, thank you so much. I learned a lot from this presentation.
Thank you, Damon.